Deep vein thrombosis is when clots form in the deep veins of the leg. This can cause two problems. One is the local obstruction of blood drainage of the leg, and so the leg can be swollen, get quite painful. If it's not treated properly, the patient will have a lot of recurrent symptoms for the rest of their life, potentially, with swollen, painful legs. Now, there's a second problem that can occur from the deep vein thrombosis, and that is that these clots can break free and travel through the bloodstream and lodge into the lungs. That's called a pulmonary embolism. And that can make someone short of breath, it causes chest pain, and if too many clots go into the lungs, your heart can actually stop beating, and it could be lethal. So the traditional treatment of deep vein thrombosis is for someone to be placed on a blood thinner like intravenous heparin or a heparin-like drug called Lovenox, which is injected in the skin. And then typically long-term someone is on a medication called Coumadin, which is a pill that you can take on a daily basis, and it requires some blood tests to regulate. Those aren't bad treatments, but we have some newer treatments we sometimes use when the clots are more extensive. So let's say someone has a bigger clot in their thigh vein, the femoral vein, or maybe the common femoral vein in the groin, or possibly the iliac vein in the pelvis, or the inferior vena cava, which is the main vein draining the abdomen. In that situation, those are large clots and they're obstructing a lot of flow. And if they're not treated more aggressively, people can have lifelong problems from that. Usually that typically would be a swollen leg or painful swelling when someone walks. So some of the new catheter-based minimally invasive techniques that we can do would involve having a patient laying on their abdomen, and then you can place a tiny little catheter into the popliteal vein behind the knee. And then through that puncture, we can pass little catheters under X-ray guidance and get inside the clot. And once inside the clot, there's a number of different techniques we can use to dissolve the clot. One of them is called thrombolysis, where we can inject a clot-busting drug into the clot. And since you're injecting it right into the clot, it's much more effective than if you were just giving it in a peripheral vein like in the hand. In addition, we can take some what we call mechanical catheters and actually dissolve the clot with those mechanical little blender type catheters. And so those two techniques, the mechanical ones as well as the clot busting drugs, are generally pretty effective. Once you dissolve the clot, we usually take pictures of the vein and make sure there was not an abnormal underlying narrowing. Sometimes there was a narrowing in the vein that caused the clot to form. And if we find one of those, we might leave a stent in place, which is a tubular metal scaffolding that will hold the vein open at the site of the narrowing. And in that situation, you've gotten rid of the clot and you've stented open the abnormal narrowing, you've restored normal flow.